Let's get oral. Let's get oral.
Hello and good morning. We're here at Let's Get Oral with my favorite co-host Jonathan, as always. And Karen Gordon is joining us today. I'm so excited to talk to her. She has had a really fascinating journey coupling the chiropractic lessons into her registered dental hygienist background. And she's now known as the chiro-hygienist. And it's given her a really interesting, rare vantage point for the deep interplay between oral health, musculoskeletal balance, and whole body wellness. So I'm excited for her to help us kind of understand how she has kind of moved into this joint collection of services using her chiropractic wisdom and her hygienist background to work on TMJ, grinding, stress, posture, and pain. And she's also co-founded Swift. So she'll talk about that. It's focused on innovating oral systemic health care and therapy. So please welcome Karen Gordon. Hi, how are you?
Good morning. I am doing awesome on this lovely morning.
Not too hot down there?
It's fire. It's literal fire. It's literal Hades here today. And Florida has the humidity. It's like, I don't know. I have to check. It's maybe 100% humidity. Okay, maybe not 100, but pretty close. You go outside
Sticky.
and
Yeah.
yeah, your hair just poofs out. It's crazy here.
Well, if you could give us kind of a background of you and your journey in oral health, first how you went into your work as a hygienist, and then what pivoted you into chiropractic.
Sure. My love for dentistry began when I was 9-ish, 10-ish, and I fell and broke my two front teeth. Okay. So that's where that
Ay,
started.
ay.
Yeah. And it was like so traumatic. But I didn't really know I would like dentistry. I know I wanted to go into something kind of medical fieldy. And just to see how my dentist was able to get my smile back and how caring everybody was. But at that time, of course, you're young, things don't click, right? And then I studied a whole degree in mathematics, and then I realized, oh my God, I like dentistry better. So I started to, I know it's just weird. And I started to obsess with my orthodontist because I started wearing braces kind of late, maybe like 18. And I'm like, you know what? Can I shadow you? I was like, yeah, sure, come in. So I used to shadow my orthodontist. I'm like, this is what I want to do. And then I migrated to the States. I'm
Can I
Jamaican.
just ask,
Sure.
when you're 18 and shadowing an orthodontist, what kinds of stuff did he let you do?
Actually, he would let me just observe. He wouldn't actually let me touch anything, but he would explain like literally everything. So I had two orthodontists, Dr. Beck and Dr. Knight, and they were the top orthodontists in Jamaica because I'm originally Jamaican, and they would let me observe. I would go into the lab. I would see how they look at cases, and so on. It was just fascinating to me, and but at that time they wouldn't I didn't touch anything. I could just look but don't touch. And
Darn.
then and then I know, right? I mean, I would get into everything if I could, but that's not how it is. We don't actually touch things. They just made us look. So then I migrated here, and then lo and behold, I'm like, you know what, I should go into dental hygiene. And that's how that journey started, and I absolutely love it because I'm service oriented, and serving the public is always what I like to do. And I've been a hygienist now for the last 20 years, and I absolutely love it.
You're still practicing hygiene as well as chiropractic?
Sure am. I mean, I don't practice as much as I used to because I focus more on teaching. Right now, I teach chiropractic at Kaiser University, so that's really my main focus. And not necessarily treating patients one on one right now. But when I do get the chance, of course, I jump in. It's interesting to see how hygiene has grown in the last 20 years. How we've become not just the teeth cleaners, but forward thinkers and co-therapists, because that's how I was trained. I was trained to be the co-therapist with the dentist, work alongside as a colleague, and make sure that our patients reach optimum care. So that was an interesting transition too.
Well, that's interesting because that's not everybody's path in as a hygienist, and some people get frustrated at kind of this simplified vision of the hygienist. So, can you speak to kind of how you found that relationship, and why you think maybe it was different for you?
I look at myself very humbly. That's number one. I don't think of myself as a diva hygienist. I think of myself as a part of the 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 sprockets in the cogwheel. Like I have to make things go around, and in order for the patient to be successful, I have to work with my colleagues. And I always believe in working well with my colleagues. Doesn't matter who it is, front desk, assistant, doctor, lab, whoever I'm working with, so that it's better for the patient. Not what I want, but what is better for the patient. So it was not really very hard for me because like I said, I'm very customer service oriented. And for me, that was easy. As long as I had a good team to work with, then things worked fine.
So, what was kind of the pivotal moment that you chose to leap into the chiropractic arm of wellness?
Ah, so glad you may ask that. Really and truly, this whole pivot really was when I kept on seeing my patients come in with like this ache and that ache, and I'm talking to them like not on a normal level. Like I would always go 10 steps ahead, right? So I'd see them and like you have something else going on with your body, right? And they're like, really, yeah, look at this, and I found myself digging deeper into way past what my little associate's degree was teaching me. I'm like, I need to kind of deep deeper dive into this. Other things I would see come into my practice, like literally all the time, patients would come in with like jaw pain, head and neck pain, and um, then I started looking at my colleagues, and my colleagues are all jacked up, right? Their necks, their shoulders, their back, their wrists. I'm like, what is going on? What am I missing here? And then I'm like, you know, just looking at the whole mouth, because I truly believe that mouth, along with the gut, really control like the rest of your body. You know what I mean?
Yeah.
And having that front row seat to show how interconnected the body is just kind of made me want to learn more. And lo and behold, an opportunity came where I live. There's opening a chiropractic school. I'm like, maybe I should do this. I'm like, maybe I should. And then, I don't want to go to medical school. That's too long. I might die. Don't want to go to dental school. That's too long. I might die too. So I'm like, let me look at this. Let me see if this works. And then, it kind of led me when doing my research. I'm like, I can treat my patient's whole body, a whole person type of approach, not just from scaling plaque, but just, looking at more, right? And that kind of sparked my interest. And I'm a person that if I get bored, don't tell my husband, he's not looking. Okay, every 5 years I get bored and I want to study something else, right? So I actually did, in between this transition, I did communication and science disorders because I thought I wanted to be a speech therapist, which isn't far from the truth. I mean, world mind functional therapy is kind of involving some of that. And I'm like, how can I connect everything? And then chiropractic was like the ding, ding, ding on my head. I'm like, okay, I need to do this. And I did.
Wow. Wow. That's really bringing it full circle and putting all the pieces together. Are you still using that myofunctional aspect in your? I would imagine so.
I try to include it in like how I teach right now. When it comes to teaching my students about, look, I don't just clean teeth. I know a lot more about you than you think. And I explain to them, you're not just about, cracking necks and backs. We have to look at the person as a whole. Like, how did the food that they ate affect how they're feeling today and their pain and their emotional state? So, those are the things that I try to incorporate. And yes, even the oral myofunctional therapy comes in handy because we have sometimes patients that have neurological deficits, or they may have muscular deficits. And those are the things that we look at and we can assess. and work alongside, of course, be a co-therapist also with whichever practitioner that they need. It just depends on what's going on with that individual. So I try to include that as part of the way that I teach. I really do use dental hygiene, my knowledge, to teach in chiropractic. I know it sounds like what, but no, the basics and the knowledge that we have. I mean, I remember being called a mini periodontist, which is just not there's it's really and truly the truth. I mean, my dentist would come and ask me if these teeth were viable. I'm like, no, they need a full denture. Meaning, from my
Wow.
experience, sometimes we would be trying to save teeth, and it just wasn't worth it because they haven't controlled their oral microbiome, right? Didn't get their systemic health under control. So what was the point of putting in expensive dental wear when they're literally leading down the path of failure?
When you see that they're not able to control their oral microbiome, what are the interventions that you lean on to get a handle on that?
Eventually, I always ask my patients to make sure, ask them when's the last time they saw their primary care physician, right? Like, why do you even need to know that? Well, the same reason why I need to check your blood pressure, right? You're not going to bleed out in my chair, or, not going to heal after treatment. I explain to them, look, there's a interconnectedness between the mouth and the rest of the body. If you're not doing well, even though I gave you everything, we've gone through everything, and I see that you're not improving in 3 months, that means that something is definitely wrong here. We need to go back to square one, start over, and think about, okay, what can we change, or what can we improve upon, or what are we missing? And sometimes you need that help. They need to go and see a specialist. They need to go and check out which microbes are actually the cause of the problem. Like, are we treating it the right way? Might be treating the wrong bacteria, or we might be treating something that's not just bacteria related. It might be overall autoimmune disease. We don't know until we push and ask them to do a little bit more. Take, how you would say, onus of their care.
Is there a specific case that comes to mind to illustrate some of the unusual systemic issues that have come forward in your
Oh
practice?
yeah, tons. There's tons. When I was working full time in hygiene, I would have a patient that there's so many cases. I could just draw on a few. Let's go down to a teenager. Okay, she was going through a lot, and she would come in and like all her teeth had incipient lesions. I'm like, what is going on with you, girl?
Wow.
And sometimes you're not just the hygienist, you're like the counselor. you know and I learned sometimes you don't speak in front of the parent, you have to speak to them by themselves, right? And I spoke to her, got kind of like the root cause, and we worked out on a plan, and that plan involved coming in often for in chairside treatment, reviewing oral hygiene care skills, talking about nutrition. Let's talk about what is it that you're consuming. Let's talk about how you're consuming it. Let's talk about all these different things. And I was able to get her motivated. And this is a big part of hygiene. It's motivating your patient. It doesn't matter how many things you throw at them. If you don't motivate
Yes.
them and change their behavior, they're not going to change. So I was able to motivate her into taking care of her oral hygiene. So, because I was caring and I really empathized with her, because I really did feel for her, just she's just going through stuff. And when she came back, her smile was different because I saw her back in like, I followed back up with her in 3 months. Her mom was happy. Her gums weren't red and inflamed anymore. Um, she did not have any new cavities. Yes, she had white spots everywhere, but guess what? There were pretty white spots now. And, that's like one case that, I could remember. I have several. And there's another case where this patient she just got bariatric surgery, and no one ever spoke to her about that connection between the gut and the mouth. Like, duh. To us, it's duh, right? But to her, she just didn't understand that. And she was having so much issues with decay. So one of the things that we talked about was acidity levels. You're now changed the way in which you eat, but now did you really change how much you ate? Because if you eat too much after bariatric surgery, what's going to happen? You're going to have reflux and so on. We talked all about that. And we also talked about, and lots of people don't know this, when you lose weight, you don't just lose weight on your body, you lose weight in your mouth, right? So
Yes,
the air,
absolutely. Say
the
more.
areas where, like, all of a sudden, why are my teeth looking like this? Because you actually lost weight. You lost tissue mass also in your mouth. So we talked about that. We talked about what oral hygiene care products we should include, and we talked about vitamins. We talked about including vitamins into her routine. Like, you don't want to end up with ANOG. You don't want to end up with, any kind of tissue issues or loss of healthy gum tissue. So we talked about including that into her her routine. She didn't understand the importance. I'm sure her bariatric surgeon and her care team talked to her about it, but she didn't think about it with her teeth, right? So I found that to be an interesting one. Now we have new stuff to think about. Now we have GLP-1.
I was just going to ask, do you think that that's something that anybody has a line of sight on, i.e., researching, looking at, evaluating?
It's I keep mentioning it. Every time I talk to people, I mention it because now it's not just you're losing weight. Now your mouth is drier. We have different
Right.
oral microbiome consistency. We have to think about, okay, it might be a little bit more acidic. So I think that the buzz is there. I haven't really seen any new research. So I'm always looking at to see what's out there, and it's slowly becoming a thing. Especially I would say in the last 3 years or so. Since now the GLP-1s are everywhere, and pretty much everybody is using some type of GLP-1 products or trying to mimic a GLP-1. So we're beginning to see it
Right.
now in the mouth and how it's affecting the whole oral systemic health and even gut health. We're seeing that.
Yeah.
I don't know if I have the right pulse on it quite yet, but it,
Yeah.
it will be there.
I think that there's a lot that we're going to be unpacking for a while from that drug application. Just there's just so much happening. We're improving a lot of metabolic measures, which is great systemically, but we are impacting bone, muscle, sub-Q fat, all of it, and visceral adipose tissue as well. So all of it is being depleted over time, and I do have concerns about early adopters, being young and during their bone formation phase, and perhaps using it prematurely. But again, you don't want to compromise their metabolic health. So there's this fine line of like health versus structure, and I think
Hmm.
it's complicated. And yeah, but I hadn't deeply considered the loss of. I was thinking just holistic skeletal loss, and of course the jaw is included in that. But you gave me something more to think about with the tissue. I hadn't quite considered that. Do you see in people that are on GLP-1s that there's a significant tissue reduction in the gums?
Definitely. A friend of mine,
Yeah. Wow.
she just lost like 50 pounds. I'm like, oh my God, why am I seeing your CEJ? Because everything shrank,
Wow.
right?
Wow.
She didn't before, when she was a little bit heavier, she had a little bit more tissue. And I would clean her teeth and I'm like, oh, okay, it looks good, you know. But then like, whoa, last time, like, wow. And then she was
Wow.
complaining about sensitivity.
Yeah.
And even from my MSK perspective, musculoskeletal perspective, more neck pain because now she's thinner, but she didn't really work out, right?
Right.
And
Right.
then she lost a lot of gluteal tissue. And okay, I don't want to say it on the podcast, but yeah, she lost her butt. And because she lost her butt, guess what she had? More back pain. And that kind
Mm.
of is that interconnectedness. Now we have more back pain. the same paraspinal muscles that run from the back of the neck all the way down to the pelvis, all the way down to the legs. Same thing when it comes to the jaw. It's just now she has a little bit more issues than she had before because she wasn't training her body.
Wow.
So I'm
Wow.
seeing that, and lots of people are on these medications and they have severe back pain. The first thing she complained to me about was back pain. And then, I'm like, okay. And when I went to clean her teeth, I'm like, oh my gosh, now I can see it in your mouth, you know? So I'm sure as we're going through this whole transition into, yes, metabolically, we want to be healthier, but what is it doing to our overall connective tissue and our muscle tissue over time?
Wow. What did you recommend for her sensitivity? I'm curious.
I recommended a hydroxyapatite type toothpaste just because the movement is away from fluoridated toothpastes at this moment in time. So that's what she's been using. Of course, she's a hygienist too, so she wants her teeth white too.
Oh, okay. Yeah.
So, so I'm like, maybe you should use this. This might help. And because we know that hydroxyapatite does in fact help to keep the bone tissue kind of hard. I kind of recommend that for her. But as per mouthwashes, I don't know what to recommend at the moment. But definitely something that will keep her not so sensitive for now.
Right. Not to do a self promotion, but since I'm here,
Of course, why
I
not?
made that mouthwash serum that has hyaluronic acid and niacinamide, and both of those would work to correct. The hyaluronic acid does a regenerative process on the gingival tissues, and the niacinamide minimizes the inflammatory process around the neutrophil activity. So both of those kind of help soothe the tissues. And I mean, they can't occlude those open exposed
D-
tubules that
right.
cause sensitivity, but they could certainly help soothe and moisturize the tissue.
And that's what I'm also seeing very red inflamed gum tissue. So this as you know, it's as it depletes the collagen in the gum tissue and so on. We People aren't thinking about that, but it's our job, right? It's our job to educate them
Right.
about, okay, this is the next thing that's going to assist you with keeping, yes, your foundation healthy, right?
Right. So now that she has all these other problems, is I'm thinking of your new gifts and talents in, well, newer than the hygienist background, and that is the chiropractic services. So now you're looking at the holistic impact of this weight loss. You're seeing it not only in the mouth, but you're also seeing uh, all the impacts from head to toe. So how are you evaluating her sleep too? Is her sleep disrupted? Is she grinding more? I'm just curious, how do you go about helping her correct some of those issues now that you have this new perspective to offer?
Well, I look at the person basically, what issues they have going on at the time. So her biggest concern was sensitivity in the mouth. And then the next thing, her next big concern was the back pain and low back pain. So those things I kind of spoke to her about. Okay, well, have you been exercising? Did you start supplementing in your diet? In fact, it was so bad at one point that she ended up in the hospital because um she removed so much of her like sugar intake, and that's like a misnomer. You kind of need sugar, right? She was just not eating quite right, and she made this dramatic, beautiful, looks beautiful, everything, but then at the same time she wasn't as healthy as she could be. It's like
Sure.
she's like skinny fat, not
Yeah.
necessarily with good muscle tone. So those are the things that we address, because before I can go
Yeah.
into like anything else, that's the one where, as per like jaw evaluation, tissue evaluation, look for the hypertonic tissues, look for any kind of deviation, asymmetry in the jawline, look at the hips. Not just the hips, the shoulders, the hips, the knees, the ankles. So you kind of look at the person from top to bottom, and then you can give them a recommendation from there and kind of evaluate, okay, what else is going on with them. And as a whole person approach, I don't just believe in just cracking necks and backs and jaws, which I never do. I don't believe in adjusting the temporomandibular joint because it's every in the chiropractic world, they don't understand that every facet, everything, every nudge on a tooth has a purpose, right?
Mm.
So when you do, for example, a temporomandibular joint adjustment, not only are you changing the occlusion, you're changing the way in which we perceive things around us, called proprioception. It changes our
Ah.
proprioceptive input. So we have to be very, very mindful of what is it that we're doing. And I would give her instructions on, of course, proper head and neck exercises, so to reduce the tension in our head and neck, and of course low back exercises. And then she's a dental hygienist, so she knows the drill about whether or not she should use a mouth guard or not. And those are just the things we talk about, and then based upon how she responds, then that's how we kind of go into the next step. I kind of like to, I don't watch and wait and see. Let's try this. If this doesn't work, let's reevaluate and go into the next thing. And I use evidence informed treatment in order to try and solve those problems.
So, when somebody comes to you with TMJ issues, what are some of your initial assessments and questions?
Sure. Number one, when it comes to TMJ issues, the first thing we do is definitely do a full TMJ assessment. So you always use a questionnaire, and the questionnaire kind of goes into, okay, are you stressed? What do you notice? When do you notice it? And that's the first thing. That's what I use to be the basis of how do I get this person back to being functional without pain. Because my job in the Cairo world is to get you to be functional without pain. So we do a full assessment. We look at the jaw, we look at the muscles around the jaw, we look at the head and neck relationship. I look at all the postural relationships, shoulders, of course, hips, ankles, knees, see how everything looks. And then I assess the body, assess the jaw joint. We do measurements just to make sure to see if there's any deviation. And then I interview my patient. It's a long appointment. I interview them to see, okay, right, you have this going on, but what else do you have going on? Strange but true, most of the times when our patients have TMJ issues, it's usually related to some kind of emotional stress, right? Some kind of emotional component, and that is that biopsychosocial component of pain. If they are stressed out, or they're not handling, or they're anxious, it tends to, the first place we see it in women, it'd be jaw and upper shoulder and neck, right? In men, low back, and then jaw. So it just depends on what's going on in their life, and then we evaluate, and then we come up with a treatment plan that works best for them, and then we go from there. Now, if it's severe, of course, that's outside of my realm of practice. I'm gonna refer you to a specialist that can look at the tissue and evaluate which muscles aren't really firing as they should, and then we kind of work together. I would do the manual therapy. They do the orthotic, and see whether if that's the best thing to help them with, because sometimes patients go in and they, for example, they go into ortho, and all of a sudden now they have this issue, right?
Ah, okay.
So we kind of work together to figure out, okay, what do we need to rehab, and what we need to kind of retrain, and what habits do we need to change so we don't end up in this particular painful situation again.
With something like TMJ, is are mouth guards something that you will instruct on?
Yes, not just mouth guards, because every situation is different. And we have,
Sure.
orthotics, which are totally different from just a regular mouth guard. They are specifically done to evaluate the bite, to evaluate, to correct, of course, their occlusal imbalances, that I let the specialist handle. Sometimes patients come in and you have them just try a mouth guard at first, because you see the bruxing, you see the wear on the teeth. Just for that period of time to see if that makes any change. And then, and of course, there's two types of night guard. We have one that we make in the lab, and then of course one they can just buy over the counter. I always try to get them to, okay, just try the thing over the counter first, just to see if that works. Most time it doesn't work because it's not custom fit, it's too bulky,
Yeah.
and then we make them a custom night guard, and that tend to really makes a difference. If we see no improvement, then I definitely have the specialist look at creating them an orthotic.
Do you find that people who are doing interventions like SSRIs, kind of addressing some of those emotive issues in the background, coming to you with TMJ, how do you differentiate between the emotional issues and the SSRI having an impact on the bruxism? It's kind of convoluted at that point, is it not?
Yes, yes. And most times when people take SSRIs,
Yeah.
it's can't even say it right. Say it 10 times fast. Um,
Yeah.
it's really you can't really separate one from the other, right? Right?
Yeah.
So if I'm taking an SSRI, it's usually because I have some kind of anxiety, some
Yeah.
kind of other issue that is not necessarily at that time it would have been TMJ related, but then now you all of a sudden you have a TMJ issue. So how would I differentiate? Definitely just when I interview the patient, right? When did this begin? Because that's what it's going to start up. When did you
Yeah.
first start feeling or experiencing this discomfort? And then you can see whether it was pre SSRI or post SSRI.
Mm.
Would I recommend them not to use it? No. We'd have to just use strategies because they need it. That's why they're on it. We use
Right.
strategies that we can help them to kind of find like the right level to sometimes titrating the medication. I can't do that. They may have to speak to their primary care provider to assist them with titrating so they find the right point at which it works best for them without the grinding and the increased muscular discomfort. Also, then it's all about, again, going back to retraining. You know, what habits are they doing? What oral habits are they doing? Are they biting on a pen all day long? Are they tensing up as they are doing their work? Right? How are they managing their stress? So one of the things that I try to incorporate is breath techniques, breathing through it, breathing through, like, take a time out, taking more rest breaks, for example. Deep thinkers like us, we hyper focus for a long time, and
Yes.
you don't even realize you're clenching your jaw, clenching your teeth. You're just hyper focused on the activity. And sometimes you have to bring to that patient, like, look, this is what you're doing, right? As if, this is what you're doing, you don't even know you're doing it. Instead of doing this, let's try that. And it's all about strategies. What strategies can we do? And then, of course, get them into the habit of doing exercises, not just jaw exercises, but maybe head and neck exercises, low back exercises. Focus their attention on something else so they're not really necessarily clenching in their jaw, grinding their teeth all the time. And if they're noticing it, you know, that's what they do in the high stress situation, then, let's find a way to manage the stress. Sometimes what we realize is they're not sleeping very well, or they don't take
Mm.
enough time to rest, or they just keep going. So kind of find out what their driving factor is.
I feel personally attacked in this interview.
No, it's it's
No,
the
I'm
truth.
kidding.
Seriously.
it's
Sort of.
it's the truth. Even myself. When we have
Yeah.
high stress job, we live in a high stress society. Society
Yeah.
is very stressed out, and we have all these goals and all these things that we need to do, and it causes anxiety. And
Yeah.
when we don't understand what the root causes of the problem, then it doesn't matter how many things I throw at the patient, how many techniques and therapies and whatever. It doesn't matter if they're stressed out, right? So
Yeah.
finding the root cause is going to be number one, or at least try to find the root cause.
Right. I mean, you said anxiety is like probably the more common backdrop and emotional landscape. Does your work with people being so intimate when you are kind of trying to unearth some of the issues at hand, Do you end up feeling more like a therapist? And then that brings me to like, is that your next foray into education?
But I tell you this, I would get so much information out of every patient while I have 10,000 instruments in their mouth as a dental hygienist. And, you know, same thing. I'm working on the patient as I'm stretching their legs and backs and everything. I'm getting so much information out, not because I'm nosy, but it helps me understand them. And then it helps me to empathize with what they're going through. And then I can direct them into how I could assist them. Now, we have a special like skill, right? Hygienist. We can get any information
Yes.
out of you in 45 minutes. We have
Tell me
10,000 things in the
more.
mouth and we'll be talking to you at the same time and getting all that information out because that's what we do. And it, you know, it's very strange. Like I would talk to patients, I would never remember their name, but I remember the conversation we talked about and what their teeth look like. And it's the same thing with chiropractic. I might not remember their name, but I remember what their case was about. So, and then we can talk about the case, and we could, keep on going and going. But yeah, that's our special skill that we have.
I love it. I love the investigational approach. That's my favorite. I don't think you could ever learn all the things about any given person in any given one moment. And the fact that you see these patients regularly is just a really interesting space to have that opportunity to really unearth some of these ongoing systemic issues. Jonathan, do you have any questions before I jump into the speaking education aspect?
Yes, I wanted to circle back to two parts.
Hmm.
You definitely highlighted with a couple case examples how the jaw and the mouth plays a role in being connected to our posture and holistic health. Have you noticed any shifts in people recognizing that in your chair or in your lives over the last, I'd say, particularly 4 or 5 years, particularly since the pandemic? Or is it still something that's really under the radar for most of us?
You know what? I think today, most people are more aware of their bodies. More people are more aware of like, oh my God, I have two temporomandibular joints. I my neck sometimes affects my back. People are becoming more aware. We have social media, which has become a platform that most people use to find information, right? Like myself, I'm a TikTok addict. I go on TikTok and that's how I do my research. If I need the latest of the latest, what's going on in the world, I go to my trusty handy TikTok or I shoot up something quick on Instagram. But um, people are more aware because people are bringing more light to things that they never thought had a connection. And yes, people are now realizing, that maybe they shouldn't hang their head so long texting and watching TikToks for hours, right? People are now more aware that maybe we should focus on our posture, just like how people are more aware that we should really start taking care of our teeth, like how we want to take care of our skin. People are more aware that, you know what? I my back hurts. Maybe I should see my chiropractor. Maybe I should start exercising. We have this whole movement, especially since the pandemic, from just living to being more active in their care, because people are more informed now. People are more willing to try to take care of themselves than just relying on a pharmacologic solution, right? And even with the advent of, yes, GLP-1s, people still want to lose weight and still want to work out and still eat healthy. If people weren't more aware, then people wouldn't want the poisonous red dye, whatever it's called, and yellow whatever in their food anymore. Now they're demanding healthier food. They're demanding better alternatives to even their toothpaste. People want better things. If I go into the deep hole of Facebook, you'll see on the keyboard warriors, they're talking about what alternatives that they can have. The big debate right here in Florida, for example, we I live in Palm Beach County. They've taken out fluoride out of the water, so now
Yeah.
on the forums. And the forums, and I think social media is the heartbeat of the pulse of what's going on in our healthcare realm. And people are asking for healthier alternatives, and that's what people want. People don't want to die from, oh, I just ate this banana and I'm going to die of cancer. I just brushed my teeth, now I'm going to die of this other things. People want things that they know are going to help them in the long run. Just like how now people are more aware of postural behavior, or more aware that maybe they shouldn't necessarily do a thing for too long. They're more aware, and we can do so much by opening their eyes to more things. And I think, definitely, I personally have grown since the pandemic. The pandemic was an eye-opening experience. I mean, hopefully I never have to go through
Truly.
another one ever again, right?
Agreed.
In my lifetime, because that was a piece of work. But then, and it was funny. In the pandemic, lots of people had back pain. I hadn't graduated yet. Lots of people had back pain, and we had to be
Mm.
very crafty. How are we going to treat people if we can't see people, right? And we got crafty, and we found ways in which to interact with our patients. And the same thing, dentistry, we became very resourceful, and people became resourceful. I think people are much smarter than we think.
I agree with you. Yeah, that it was, I mean, at the end of the day, a pretty cool experiment. We all learned a lot from. Just not exactly the way I would want to learn, but it's what it is.
Mm-hmm. Mm-hmm. Following up that, you mentioned the awareness, how it's expanded and grown over the last few years of body connectedness and finding ways to either optimize or improve different aspects of our well-being. I believe one of those trends when it comes to jaw tension has been the use of a neurotoxin,
Mhm.
right, for relieving that pain and discomfort. Could you speak or elaborate more on the use of such compounds for addressing TMJ issues, and whether or not there's things that are being overlooked when we talk about root causes?
Oh, definitely. When we use, of course, the most famous one, I would call the name, this particular toxin, yes, it has its role. Everything has a role, and not everything's for everyone. But we shouldn't necessarily jump to that first, because it would be like a band-aid over a gaping hole. So, one of the things we have to look at, it does provide temporary relief, of muscle tension, but it doesn't really address the underlying structural or postural or emotional components of the problem. And some of the limitations we have when it comes to the most famous one, I won't call the name, is, of course, yes, it does muscle paralysis, but then over long term, it's going to cause jaw instability, right? It won't have the same tension it's supposed to have in order to keep the jaw where it needs to be. And yes, it does stop the pain, but it doesn't change the root cause. And then again, what we're trying to avoid, and in my world as a chiropractor, in my world as a dental hygienist, we're trying to avoid altered joint mechanics or any compensatory movements that we might end up. Yes, we fixed the jaw issue, but now we have a neck and shoulder issue, right? And then patients are patients. They're going to become addicted to, not, I wouldn't want to say addicted, let's use a different word. They're going to become dependent on this pharmacological
Right.
intervention. And they haven't actually pursued figuring out what the problem is, right? Um, Statistically, most of the cases, 70 to 80% of these patients have short-term relief, which we want, and I get it. It is painful, but again, only 20 to 25% have lasting improvement without addressing the underlying issue. That means we're not really solving the problem. So
Right.
even though it doesn't necessarily, it does help. It doesn't help with these biomechanical imbalances and these facial tension patterns. Like, how are we addressing airway dysfunction, proprioceptive disturbances? So we have to look at the whole person and not just look at just the overactive muscles in the temporomandibular joint. The whole system approach is going to lead us into possibly doing like posture analysis, breathing, bite alignment, and of course, even evaluating sleep, and of course, whatever emotional load that they may have. So honestly, I believe it should be like a last resort, just like how I believe if a patient has back pain, they shouldn't jump and do surgery first, right? Maybe we should try some other interventions first before we go to the surgical aspect. That's the last thing. And it's the same way I feel about even surgery on the temporomandibular joint for, they putting in the disc and so on. We have to explore all options first, and then if that doesn't work, then of course employing a pharmacological solution is would be okay. We just can't jump there first. That's my big thing.
Got it. Yeah, that's fair. I wanted to talk about you as a speaker, educator in this space. What kinds of areas are you lecturing at? Are you doing oral health conferences? Are you doing like A for M? Or where are you at? Or how can we find you out in the wild?
Sure. Well, I am on all of the social media spaces. TikTok, of course, my favorite. Instagram, and I'm on Facebook. On TikTok and Instagram, you can find me as the chiro-hygienist. On Facebook, it's my whole government name, Karen Ann Gordon. You'll find me on Facebook. And speaking, I'm kind of cooled down on the speaking this year because I'm focusing on kind of growing my knowledge base. I like to learn more so I can give more. So right now I'm in my learning space. I'm looking to go into some chiropractic neurology, which will help with a lot of the functional imbalances that we have with TMJ. But speaking, I did a lot of speaking events the last 2 years. And I'm kind of cooling off just right now. I want to really speak at some of the bigger oral conferences. I've spoken before, Faculty of Chiropractic, American Chiropractic Association, and I've talked about dentistry to them and how kind of change the way in which they evaluate the TMJ case. And my biggest thing I love speaking about is of course how temporomandibular joint affects everything. It's like that Kevin Bacon game, right? 6 degrees of separation. You can
Yes.
almost, like, if you have a TMJ problem, you can link it to something else musculoskeletally, or you can also look at how it influences something else. So in the speaking space, um, I'm always looking for new things to talk about when it relates to temporomandibular joint, because I feel like it's that little one thing that links everything. And my new obsession, of course, is oral systemic health connection. How it affects our muscles, our body, how the oral microbiome is really and truly the big influencer. I remember I was in micro class and my teacher was saying to me, she was saying, it's the microbiome, it's the organisms that's gonna get you. So and it's true. She's thinking everything at a cellular level, and from a microscopic level, that's what actually is um driving us as people and as bodies and how we feel. So that's where I'm trying to grow my space, trying to grow my knowledge base this year. I'm focusing on growing knowledge. I'm hoping to speak next year a lot more, especially in the IOM. I want to speak for them again. It was good. I did that before. I spoke for USET last year. That is it was very interesting to talk to them about diabetes and oral health. That was great, and I love those spaces. And maybe one day I speak at ADA. Who knows? But I'm RDH under one roof. Definitely, if you haven't gone, definitely I recommend. That's my dream, to be able to speak there. So I'm working on trying to get more speaking engagements. But for right now, you can find me really speaking a lot at school where I teach.
Sure.
And then my plan is to really do a lot more speaking engagements in online. Really trying to educate more online, because that's a platform that everyone can have access to, and learn more about how
Yeah.
these different parts of our bodies are interconnected.
Can you talk to us about Swift and what
Sure.
you're doing with it and where you aim to take it?
So Swift started with a group of friends of mine when I was in chiropractic school. It's interesting because we are, when it comes to females in healthcare, we don't, in our group as chiropractors, we don't have, it's mostly male dominated. So SWIFT stands for Strong Women Inspiring Interdisciplinary Fortitude and Transformation, and it was really brought about to uplift women in healthcare. It's or we only have one chapter. It's on the Kaiser University campus in West Palm Beach. That's where we started it, and we found that women, especially in healthcare, they have different things that they have to consider. How we treat our patients, we're dealing with burnout, isolation, we wanted to create a space that we could collaborate through a sisterhood. And that's how, that whole change came about. And we create spaces for mentorship, community service, and we're definitely big on interdisciplinary approach to healthcare because I believe we really need each other. We can't think of us all as being separate beings. And our whole aim is to work to transform women in their communities when it comes to being healthcare practitioners. In the past, we've given out scholarships to students so that they can continue to pursue their education in healthcare, and that's really what we're about. We want that to keep on going and growing because we find that our struggles are a tad bit different when it comes to healthcare, and we wanted that interconnectedness and sisterhood.
That's incredible. I love that. I remember doing leads when I was much younger and just trying to get comfortable with public speaking, having access to support like that, but having it be women in healthcare, that's a whole nother level of empowerment. So incredible. Thank you for speaking to that. And how would somebody get involved?
Well, right now we're on the campus at Kaiser University. Definitely, that's our small area right there. That's where we started. You can send me a shout out. Message me, DM me, send me a message if you're interested in participating, and learning more about how you can support like the scholarship efforts. That's the best way to get in contact with me and learn more about Swift.
Cool. Thank you. Jonathan, do you have any follow ups?
One last question for you, Karen.
Sure.
And so we do like to ask our guests towards the end if there are any books, TV shows, video games, any form of media that you've been currently or recently consuming that's caught your interest.
Oh my God. Okay, don't laugh. I love Chit.
Love Island, right? I'm just kidding.
No, no, I love Chit. Chit is like Chit's a character. He's a new character on I found on TikTok, and he's just hilarious. He is always at work, not working, and he's just a character. So if you haven't found him yet, find him. Books, I know this sounds bad, but I don't like reading books. I'm a movie watcher, so I love to watch movies.
Mm.
I only read books. I only read for information. I'm sorry, I'm a bad nerd. I like to read for information. I don't like to read fiction. I am a TV watcher. I'll watch everything on the planet. I am a Star Trek girly. I'll watch everything Star Trek.
Hey.
See? So much better. And then I love medical dramas. I just got went to watch The Point, so I'm gonna try and watch that. So I'm all into medical dramas. Not necessarily Love Island girly. I just can't connect with that. I'm more of a come on, I came from the era of X Files, and I'm so glad they want to reboot that. So,
Did so have you watched Murderbot yet?
no, but that sounds very interesting. Interesting,
It's
Murderbot.
it's clever, very clever. I
Mm.
highly recommend it, especially with your interests of the health and also the Star Trek. I mean, all of it aligns. That it's a really fun take.
Oh, great! I'm great. I'm not the
I'll
only
leave it
person
there.
out there that loves Star Trek. Like, I watched all of them, even the new episodes. Like, oh my god, I need to watch more. So I am a Star Trek person. I'm an X Files person. I am a medical drama person, and that's me, and I'm sticking to it.
Yes, I'm all in with you there. Well, thank you so much for coming on the show. It's been absolutely delightful to understand your journey and to get a better understanding of that TMJ oral health musculoskeletal axis. So thank you so much for bringing your expertise to Let's Get Oral.
Thank you so much for having me. I really enjoyed the show.